How's it going, everyone? It's Jerry here with Any Level Fitness. I want to talk about some exercises to start doing if you're experiencing any type of hip pain, or maybe you're about to have like a hip replacement surgery or any type of surgery is done to your hip area. Because the few things that we have to think about when it comes to strengthening the hips out is, what do our glutes do? Which our glutes are majorly responsible for anything that you do with your hip. So when we kick our leg back, so we go into a hip extension, it's the glute muscle. If we have external rotation of the hip, a glute muscle is working. And if we have abduction of the hip, a glute muscle is working. Now there's actually three muscles that you're going to be working in this sequence, in these three sequences. And one is the glute max, so that's the big superficial muscle in the back. You have the deep glute muscles, which one is the glute medius, and there's a glute minimus. Those are right there in that ball and socket area, right in the hip. So if you're going to go through a hip replacement, we need to make sure these little muscles are strong, because they're going to get cut whenever they do the replacement. But anyways, we're going to sit down on the floor. You're going to get one of these bands. We're going to put it over both of our legs. We're going to put it right above our knees. We're going to sit up nice and straight, draw our belly button in to get your core tight. And we're going to go out and then in. So now we're doing a little external rotation of the hip. Let's go side and back and forth here. I do about 10 and then switch. We got 10 this way. If you can stand up and standing for a little bit of time doesn't bother you, then we can do this one. So we'll put the band right around our ankles, and we're going to get to our table or countertop, maybe even the back of a chair, where we're going to put our hands on it and keep the right leg straight, and we're going to keep the left leg back. And we're going to try to squeeze our glute. So squeeze your left glute when you do this. And then again, I would do about 10 to 15 repetitions per leg. The next one, if you can't get down on the floor, get a table or maybe even your bed. We're going to lay down here and keep this band around our legs. We're going to put it right above our knees. Lay on our back. Smash the lower part of your back on the floor or on the table or bed. We're going to drive our heels into the floor or the table. We're going to raise up, squeeze our glutes. Raise up, squeeze our glutes. We're going to do that for good. I would say start off with about 10 repetitions. If 10 is pretty easy to do, then I would do 20 repetitions. So there's 3 exercises that we can start doing. We can even add a 4th one in there, which is just a standing side leg raise. Now, the external rotation here, when we do this one, we're working the glute medius and glute minimus. The glute max works a little bit too, but we're really working those 2 little muscles that's really deep to our glute max. And then the side leg raises, the abduction is working those 2 small glute muscles as well. And then the kickbacks is more working the big muscle, the glute max. And then when we lay down on the table, we're working the glute maximus also. But those 3 muscles and those 4 combinations of exercises are really important to get those hips strong, to get those glutes strong. And what I would do is I would probably do that at least probably like 3 times during the day of like 3 sets. So I went and I did the external rotation sitting down for 10, both legs. I did the kickbacks for about 10 repetitions. Then if you can, stand there holding on to something, do the abduction exercises for 10, and lay on the table and do 10 to 20 glute bridges. I would do that for 2 to 3 more times in an exercise. Really depends on how much you can handle, how your glutes feel as you're doing this. So at least 1 set of everything, 2 sets if you're feeling good, 3 sets if it doesn't really fatigue your glutes and legs out that much. But give those exercises a try, and I would do those at least 3 times a week. So like a Monday, Wednesday, Friday. Okay? Got any more questions? Feel free to reach out.